So there are two forms of thyroid disease that we see. There's hyperthyroid and there's hypothyroid. And we'll talk about autoimmune thyroid because that's very different than the hyper and the hypo. So when somebody is hyperactive, that's when you typically see them losing a lot of weight. They're like the Energizer Bunny. They can't stop. They're constantly on the go. They can eat as much as they want and they can't gain weight. They don't sleep well. They're awake all night. Sometimes you'll see them, they'll have bulging eyes, and they're very anxious, very jittery. That's the hyper side. We don't see that happen as frequently as we see the hypo side. So the hypo side means it's underactive, and you have all those opposite effects of hyper. So you're sluggish, you have weight gain. The body has slowed down to a point where all the organ systems are slowing down. You get dry hair and dry skin and dry nails. And that's typically what people will present with when they're concerned of a thyroid condition. Now, when you come to see us, we're going to measure thyroid, but we're going to measure it very differently than the conventional doctors do. In our conventional world, the only thing doctors are concerned about is your TSH level. And if that's abnormal, they'll look at T4 maybe. When we look at thyroid, we want to see that whole pattern of thyroid function. So we want to measure something called a TSH and a free T4 and a free T3 and a reverse T3. And yes, we're going to look at thyroid antibodies because that could be the underlying cause of your symptoms. But yet maybe we're not seeing your laboratory results indicate that there's a change yet and you're very symptomatic. So we look at that full encompassing picture of thyroid. And then from there, we're also going to look at something that's different that's called subclinical hypothyroidism. That's where maybe your numbers aren't severe enough to the point where we're going to say, yes, you have a blatant disease state, but you have all of the symptoms and your markers are beyond the point where they should be normal. And we're going to go ahead and we're going to implement some treatment automatically before they get so bad, because you could live in that state for 10 years before you actually get diagnosed with hypothyroidism. And there are a lot of different ways that we can treat hypothyroidism. There's herbal remedies that we can use. There's conventional medicine that we can use, although we try to avoid that if at all possible. And then there's a natural thyroid supplement that many people have heard of called Armour Thyroid, which is a glandular thyroid. It's the first thyroid that was ever identified over 100 years ago, and it's still available on the market today. And there's many other glandular products that have come since Armour Thyroid. Some are better, some are not, but we can utilize those things as well. And then we can also use something called compounded thyroid, where we combine T4 and T3, but it's not from a glandular component, it's just the bioidentical hormone piece itself. So for people who have a pork allergy, or for whatever religious reason they can't use pork, or maybe they have that autoimmune component and that pork product, that glandular product has made their thyroid worse, we can use a compounded thyroid where you can get a lot of the benefits that you wouldn't be able to get from traditional Synthroid. So there are lots of different ways for us to look at thyroid, and we want to look at that all-encompassing picture of thyroid. We also want to look at adrenal function because adrenal glands and thyroid go hand in hand. If one is off, usually the other one is off. They have to communicate with each other, and oftentimes when somebody's been in a chronic condition, those two organs get imbalanced and they no longer communicate properly, and their symptoms will mimic one another. And so it'll be difficult sometimes to tell, is this adrenal or is this thyroid? But we have ways of figuring that out as well.